In emergency medical services (EMS), the role of a left ventricular assisting device (LVAD) becomes increasingly significant when responding to patients with advanced heart failure, particularly in the context of the assessment of life-threatening situations. An LVAD functions as a mechanical pump that assists the left ventricle in circulating blood throughout the body, ensuring that vital organs receive necessary oxygen and nutrients during cardiac distress. When paramedics encounter a patient with an LVAD, understanding the device's mechanics and purpose is paramount. These devices are often implanted in patients awaiting heart transplants or those who are not candidates for surgery. The LVAD takes over part of the heart's workload, enabling individuals to maintain a semblance of normalcy in their daily lives. Paramedics need to quickly assess the device and the patient's overall condition, as these patients may experience complications such as infection or thrombosis that necessitate immediate intervention. A crucial aspect of managing an LVAD patient in the field involves recognizing the clinical signs of device malfunction or patient decompensation. Paramedics should be adept at identifying symptoms such as hypotension, altered mental status, or excessive bleeding. Furthermore, understanding the alarms and notifications emitted by the LVAD can provide invaluable insights into the device's operational status. In cases where the device fails, every second counts, necessitating a swift transition to advanced life support protocols to stabilize the patient before transport. Effective communication between the EMS team and the receiving hospital is another critical element of LVAD management. Relaying accurate information regarding the device settings, patient status, and any interventions performed en route is essential. This ensures that the accepting medical team is fully prepared and that continuity of care is maintained beyond the ambulance's threshold. Additionally, training and education for EMS personnel on LVAD technology will enhance preparedness and confidence when faced with the complexities of such cases, ultimately improving patient outcomes. In summary, the integration of LVADs into the ALS paramedic response exemplifies the evolution of pre-hospital care. Paramedics must approach these situations with knowledge, skill, and compassion, aiming to provide the best possible care for patients relying on these remarkable devices. This enhances the quality of life for those in need and underscores the critical role of paramedics in pioneering advanced cardiac support during emergencies.